This is JAPI, and welcome to JAPI Podcasts.
I am Dr. Nihar Mehta. Welcome to the JAPI Podcast of the May 2024 issue of JAPI, Volume 72, Issue 5. This issue of JAPI has some really interesting articles, including 11 original articles, 2 review articles, 1 consensus statement, as well as 5 case reports, 1 unique case series, 1 point of view, and 1 pictorial CME. There are also some letters of correspondence. We will be discussing the original articles and the review articles in detail in this podcast. The first original article is on identifying the probable etiology of acute undifferentiated fever through inflammatory biomarkers. This is by Varadaraja Govindaraj et al. The aim of this study was to identify the probable etiology of acute undifferentiated fever through inflammatory markers. Acute undifferentiated fever is defined as any febrile illness with a duration of less than 14 days without evidence of a localized infection. The objective was to study the clinical and biochemical parameters as possible predictors of adverse outcomes in acute undifferentiated fever. This study was a prospective observational study carried out in the Department of Medicine in a tertiary care hospital. It was carried out for 1 year, and a total of 400 patients from the OPD and inpatients were enrolled. Variety of bioinflammatory markers like ESR, CRP, D-dimer, ferritin, and prolactin, along with basic blood and biochemical tests were measured. The level of the rise of all these measured inflammatory markers were analyzed for clues towards identifying the etiology. Also, the possible predictors of adverse outcomes were analyzed. The results of this study were quite interesting. The common etiologies in the study were dengue fever, which was seen in 31.5%, COVID-19 in 18.5%, enteric fever in 12.7%, scrub typhus 9%, and malaria in 6%. In 19% of the cases, the fever remained undiagnosed. Now, there was a pattern which was quite evident in terms of the biomarkers and the particular etiology. Enteric fever had highly elevated CRP, more than 30, and a moderately elevated D-dimer, ferritin, and procalcitonin. Both non-severe dengue and COVID-19 had very high D-dimer, more than 750. But in non-severe dengue, the CRP, ferritin, and procalcitonin were only mildly elevated, whereas in COVID-19, the CRP and the ferritin were moderately elevated with only a mild elevation of the procalcitonin. Scrub typhus also had a highly elevated CRP with a highly elevated ferritin, but the D-dimer and procalcitonin were only mildly elevated. The mean serum procalcitonin in enteric fever was slightly higher than in other etiologies. This study was correctly able to identify 90.8% of non-severe dengue, 87.8% of typhoid, 83.6% of COVID-19, and 91% of scrub typhus only based on inflammatory markers. There were certain factors which were associated with more adverse outcomes, such as obesity, diabetes, hypertension, coronary artery disease, malignancy, chronic kidney disease, and chronic lung disease. To conclude, this interesting study is one of the first few studies comparing the rise of the various patterns of these inflammatory markers amongst these common etiologies of acute undifferentiated fever. The novelty of this study is that it aids in identifying the probable etiology of acute undifferentiated fever with good confidence through the various levels of routinely measured inflammatory markers. The limitation of this study was that it had a relatively small sample size and it was a single center study. But the study does give us patterns of inflammatory markers, rise and falls in these common etiologies, which may be validated for future reference for easy diagnosis. The second article is titled The Study of Association of Erectile Dysfunction with Metabolic Syndrome and its correlation with endothelial dysfunction in an Indian population by Ritu Caroli et al. The aim of the present study was to determine the association of erectile dysfunctions in patients with metabolic syndrome and to determine the correlation with endothelial dysfunction. This hospital-based study evaluated 120 male patients with 120 age-matched controls. Metabolic syndrome was diagnosed according to the International Diabetes Federation criteria and was measured using flow-mediated dilation, that is FMD method, with the help of ultrasound used to assess the endothelial dysfunction. Diagnosis of erectile dysfunction was based on the International Index of Erectile Dysfunction, that is the IIEF scale. The results were quite startling. The study participants had a mean age of 40.9 plus minus 11 years. The majority of cases, that is 57.5% of cases, had a less than 6-month history of metabolic syndrome. The presence of erectile dysfunction was a whopping 31.7% in cases compared to only 5% in controls. The IIEF scores of erectile dysfunction were significantly lower in cases compared to those in controls. A moderate positive and significant correlation was observed between the FMD and the IIEF scores. With an increasing number of metabolic syndrome components, there was a significant increase in the prevalence of erectile dysfunction. Additionally, those with erectile dysfunction had significantly lower mean FMD values compared to those who did not have erectile dysfunction. The conclusion of this very interesting study shows that there is a significant association between erectile dysfunction and metabolic syndrome. This study observed that the increase in the components of metabolic syndrome increased the prevalence of erectile dysfunction. Additionally, endothelial dysfunction was also correlated with erectile dysfunction. The next review article is on adoption of technology by healthcare personnel in an institutional survey by Neha S. Katharagada et al. Now, we know that technology has a significant influence on healthcare outcomes. Despite this, there are several barriers and concerns towards the adoption of digital laboratory reporting systems amongst healthcare professionals in India. The aim of this study was to understand the overall attitude, barriers, and motivators towards the adoption of technology by healthcare professionals. It was a single-center prospective questionnaire survey amongst 107 physicians and surgeons of various specialties. The electronic laboratory system at the institution could be accessed across any computer terminal and through a web-based application that could be downloaded on any mobile device. The result of this study revealed that 98 out of 107 healthcare professionals, that is 92%, used the digital platform regularly, while only 9, that is a total of 8%, did not use it at all. The mean satisfaction score of users was 4.62 on a scale of 0 to 5, 5 being the most satisfied. The study showed that most users found the digital system to be easy to access and easy to use, more secure and reliable, which led to significant time saving compared to paper based systems. This study also found an important factor is age, which was a determinant of usage. Younger healthcare professionals were able to use these applications more frequently and more easily. Overall, the study suggests that digital laboratory reporting systems have benefits, are easy to use, and further efforts are needed to increase the adoption of these healthcare systems all over India and across all age group of physicians. The fourth original article is titled The Fear of Coronavirus Disease 2019 Amongst People with Epilepsy by Rajendra Kumar Surekha et al. This study involved 205 patients with a diagnosis of epilepsy. The questionnaire included questions about social demographic information to evaluate the fear of COVID-19 infection using the Fear of COVID-19 scale, FCV-19S. This FCV-19S scale is a 7-item instrument designed to assess the fear levels related to COVID-19 infection, with higher scores indicating greater levels of fear. Participants rated each question on a 5-point scale. Therefore, the comprehensive score had a potential range between 7 and 35. The cutoff of 16.5 was used to identify individuals experiencing fear of COVID-19. The results showed that of the 113 enrolled participants, 55% were male with an average age of 27 years. The mean fear score was 14.25, and the fear of COVID-19 infection was present in 41, that is 20% of participants, with a mean standard deviation score of 23.90. 29, that is 14% of participants believed that COVID-19 infection could increase the chances of having seizures in the future. Participants who were more than 45 years of age, married, graduated, and had low family income were significantly more likely to be fearful of COVID-19. Using logistic regression, education, marital status, and family income were identified as risk factors for having significant fear of COVID infection. To conclude, given the notable prevalence of COVID-19 related fear with epilepsy in the community, it is advisable to develop a well thought out strategy for the prompt identification of vulnerable patients who may be at an increased risk of experiencing fear and anxiety in this COVID-19 pandemic. The next original article is entitled A Comparison of Forced Oscillation Technique, Lung Volumes by Body Plethysmography, and Spirometry in Moderate Persistent Adult Asthma. This study has been conducted by Tanya Athavale et al. Moderate persistent asthma requires daily treatment with inhaled corticosteroids. Spirometry is used extensively, but airway oscillometry is gaining acceptance for evaluating obstructive airway disease. This study aimed to evaluate the relation between airway oscillometry and lung volume, which are the markers of lung physiology in obstructed airways, and spirometry in the real-world clinical setting. 72 adults with moderate persistent asthma, followed up in the OPD from November 2021 to August 2022, and their clinical details, spirometry, the forced oscillation technique, and lung volumes by body plethysmography were performed before and after bronchodilator administration, and these results were analyzed. The results need to be explained, especially the oscillometry findings. The oscillometry findings are measured in R and X. R is the in phase and X is the out phase component. Normally, the resistance or the R at 5 Hz and at 19 Hz are comparable. But when there is an increase in the R5, it suggests peripheral airway obstruction and predicts the risk of exacerbation of asthma. X is measured at 5 Hz and an X5 measures the mass inertia forces and lung compliance. Now, the results of this study were as follows. The mean age of the population was 40 years, 57% were females. The forced oscillation technique detected airway limitation in 12 out of 31 patients who had normal spirometry findings. Body plethysmography detected abnormalities in more patients than both spirometry and the forced oscillation technique, and this result was significant. The R5 had a negative correlation with the functional residual capacity and total lung capacity. The X5 correlated positively with the inspiratory capacity and the TLC, and negatively with the reserve volume by TLC ratio. Spirometry detected post-bronchodilator responsiveness in more patients than the forced oscillatory technique when only the R5 criterion was used, and in a comparable number when the X5 criterion was used. To conclude, there is a moderate correlation between the forced oscillation technique and spirometry and lung volumes by body plethysmography. Forced oscillation technique and spirometry should be used together to identify the air inflow obstruction and post-bronchodilator responsiveness in asthma. Lung volumes by body plethysmography identify far more abnormalities in adults with asthma than both spirometry and forced oscillatory techniques. The next original article is an observational study of the physical and biochemical complications and socioeconomical status of type 1 diabetes patients in West Bengal, a 25-year follow-up report of 224 patients by Debashish Maji et al. The objective of this study was as follows. First, to obtain the glycemic, socioeconomic, and complication status of type 1 diabetes patients. Second, to see any change of the above-mentioned parameters in this follow-up period of 25 years. Third, to take necessary action to improve the quality of care and the health condition of the type 1 diabetic patients attending the clinic. This study was a longitudinal observation study. A total of 265 patients were recruited, having been diagnosed with type 1 diabetes within 1 year of diagnosis. 224 patients were classified into 5 cohorts according to their first attendance in the diabetic clinic. 1996 to 2000 was cohort 1, 2001 to 2005 cohort 2, 2006 to 2010 cohort 3, 2011 to 2015 cohort 4, and 2016 to 2020 cohort 5. Baseline and socioeconomic based on education and occupational status data was obtained at the first visit, and the mean biochemical parameters were taken from multiple visits. Complication rates, mortality rates were calculated against the duration of disease at the end of the study. The results were as follows. 111 males and 113 females were enrolled. The mean fasting blood glucose levels, post-meal blood glucose levels, and HbA1c levels were as follows: 227, 203, and 8.65 in group 1, 117, 182, and 7.33 in group 5. The difference was statistically significant between group 1 and group 5. The occupational status improved over time. Thus, more type 1 diabetic patients are becoming earning members of the family. Other findings were that the use of pen devices for insulin, glucometers for home glucose monitoring, and cell phones to connect with caregivers has also shown a gradual increase. Delayed development of complications and comparatively long life were also observed. The conclusion of this study was as follows. Several methods of improvement of clinical management of type 1 diabetes, including continuous diabetes education with proper training, the use of pen-based devices, ease of insulin injections, the use of glucometers, the use of cell phones to communicate, can improve the diabetic care, leading to delays in the development of diabetic complications and ensuring longer as well as healthier lives for type 1 diabetic patients. The development of the socioeconomic status of the country also has played some role to meet the demand of the cost of care for these patients. The next interesting original article is titled The Role of Serum Calcium, Serum Albumin, and Serum Uric Acid as Markers of Initial Neurological Severity and Short-Term Outcomes in Acute Ischemic Strokes. This study is by Pavan Kumar Bharamaraddy Chinnamawar et al. This is a 1-year observational cross-sectional study of 65 individuals who experienced acute ischemic stroke within 24 hours of onset. Patients with hemorrhagic strokes, chronic liver, and chronic kidney disease were excluded. At admission, the serum calcium, serum albumin, and serum uric acid were measured along with the National Institute of Health Stroke Scale Severity, that is the NIHSS Severity Scale. The modified Rankin scale, that's the MRS scale, was done at the end of the first week to determine the short-term prognosis. The results of this study showed that in the 65% study, stroke was common amongst 50 to 80-year-old patients. Participants included 45 males and 20 females, with a total of 17 individuals having hypertension, 19 having overlapping comorbidities, 6 having diabetes, and 5 having coronary artery disease. The results show that only a low serum calcium was found to be positively correlated with the NIHSS scale. Serum albumin and serum uric acid did not affect the NIHSS severity. All three signals were unrelated to the MRS scale. So in conclusion, the low serum calcium exacerbates the NIHSS scale, but it was unrelated to the albumin or the uric acid levels. The MRS scale was unaffected by all these three lab factors. The ninth original article is titled A Study of Cerebral Venous Sinus Thrombosis with Special Reference to New Risk Predictors by Janak Kumar Kambholja et al. The risk factors for venous thrombosis in general are linked classically to Virchow's triad of stasis of blood, changes in the vessel wall, and changes in the composition of blood, that is hypercoagulability. There have been numerous studies evaluating long-term as well as short-term outcomes in the presence of these inflammatory mediators. They have been reported to be beneficial in predicting outcomes and hence potentially in guiding management. The aim of this study was to evaluate the prevailing risk factors associated with cerebral venous sinus thrombosis, as well as to describe the distribution of new inflammatory markers amongst the study population and their association with functional and neurological outcomes at 30 days following the occurrence of the cerebral venous sinus thrombosis. 30 patients were enrolled and all their data was accumulated. Patients were called for follow-up after 1 month of detection of the cerebral venous sinus thrombosis, and their neurological status was recorded on the Glasgow Coma Scale and functional status on the modified Rankin Scale. The results showed that amongst 30 patients between the ages of 18 and 70, 63% were males. No risk factor was identified in 23% of cases. The most common risk factor was the presence of substance abuse. Amongst presenting features, headaches were the most common, followed by seizures and neurological deficits, that is in 83, 30, and 23% respectively. Coexisting intraparenchymal hemorrhage was seen in 46.67% of patients, with the transverse sinuses being most commonly involved in 28% of patients. The median neutrophil to lymphocyte ratio was 3.4, with an interquartile range of 2.6 to 5.6. The median platelet to lymphocyte ratio was 160, with a range of 107 to 227. The median systemic immune inflammatory index was 1067, with a range from 509 to 1522. The systemic immune inflammatory index is the platelet count multiplied by the absolute neutrophil count divided by the absolute lymphocyte count. These three values, that is the NLR, neutrophil to lymphocyte ratio, the PLR, that is the platelet to lymphocyte ratio, and the SII, which is the systemic immune inflammatory index, were found to differ significantly among subgroups having good and poor neurological outcomes. The NLR, PLR, and SII values on admission showed a positive association with poor neurological outcomes. To conclude, this study shows a significant correlation between the values of CBC-derived inflammatory markers on admission. Higher-powered studies are needed to assess the potential benefits of incorporating these simple markers in existing risk stratification models to improve the outcomes and the predictive accuracy of these markers. The next original article is a study on the drug prescribing patterns vitiligo patients of Andhra Pradesh in a tertiary care teaching hospital by Somana Boina Padmakar. In India, the prevalence rate of vitiligo varies between 2 to 8% depending on the region. This study is aimed to assess the drug prescribing patterns in vitiligo patients. This prospective cross-sectional study was carried out in the dermatology department of a government general hospital in Andhra Pradesh from December 2019 to 2020. Patients aged more than 18 of both genders and diagnosed and receiving treatment for vitiligo were included. All medicines prescribed to these patients were collected on the pre-designed case report forms. This study showed that the most commonly prescribed class of drugs were corticosteroids, 42.9% of patients, followed by calcineurin inhibitors, 13.4%, vitamins in 14.6%, basic fibroblast growth factor, BFGM, 9.5%, moisturizers, 6.9%, antihistaminics in 6.5%, and minerals in 6.2%. Amongst corticosteroids, betamethasone was the most commonly prescribed drug, followed by clobetasol propionate. Topical drugs were prescribed more often than oral drugs. This study concludes that most of the patients of vitiligo were treated with topical and systemic corticosteroids, followed by topical calcineurin inhibitors, that is tacrolimus, in combination. The prescription pattern in vitiligo patients is as per guidelines and recommendations. More studies are needed to determine the prescription patterns in other centers across the country. The next original article is an association of diabetic peripheral neuropathy with micronutrients by Sandhya Gautam et al. Diabetic patients usually have high levels of oxidative stress. Mitochondrial dysfunction and inflammation of blood vessels are associated with a greater need for micronutrients in diabetic patients. The purpose of this study was to show the association of diabetic peripheral neuropathy and the levels of micronutrients like copper, zinc, magnesium, and vitamin B12. This cross-sectional study was conducted in the Department of Medicine in Meerut, enrolling a total of 130 randomly selected cases of confirmed type 2 diabetes. Diabetic peripheral neuropathy cases were identified using the Michigan Neuropathy Screening Instrument. Out of 130 patients, 28 patients were found to have diabetic neuropathy. The level of micronutrients was assessed and correlated with the development of diabetic peripheral neuropathy. This study had 65% males, 51% of the subjects were more than 50 years of age, and 67% of the subjects were vegetarian. The association of diabetic peripheral neuropathy with decreased levels of zinc and vitamin B12 were found to be significant, whereas copper and magnesium levels were found to be insignificant. Although this study had a very small sample size, it can be concluded from the study that altered levels of trace elements have a role in the pathogenesis and progression of diabetic neuropathy. It is suggested that an adequate supply of substances like zinc and B12 in the diet of diabetic patients can be beneficial in the long-term management of these diabetic patients. This systemic review and meta-analysis was undertaken to identify the risk factors of long COVID-19 so as to provide insights for selecting cases for more aggressive monitoring and treatment after COVID-19 infection and to reduce the morbidity due to long COVID-19. All relevant studies published in July 22 were searched for in PubMed, the TRIP database, and the Cochrane Central Register of Controlled Trials, the Cochrane Library. Google Scholar and the National Institute of Health Clinical Database were also searched for unpublished studies. All cohort studies which studied risk factors for long COVID-19 in adults more than 18 years were included. The outcomes were risk factors identified as being related with persistent symptoms 3 months after recovery from COVID-19. A total of 9 studies were included. Pooled results demonstrated statistically significant association of long COVID-19 with female gender, the need of hospitalization, and the length of hospital stay. There was no association found between the number of comorbidities and chronic obstructive pulmonary disease, as well as persistent symptoms. So this study gives us a very clear 3 points which need to be monitored for patients with long COVID-19. These include the female gender, need for hospitalization, and the duration of hospitalization during acute COVID-19. These are the risk factors for later development of long COVID-19. There should be a specific guideline for monitoring and treatment of this population with these simple risk factors after acute COVID-19 infection. Thank you for listening to JAPI Podcasts.